So my goal tonight is that we're going to talk about some general overarching issues involving waivers. We're going to talk about the family support and the CIH waiver. Then we're going to talk about the traumatic brain injury waiver. Then we'll talk about health and wellness. Next, we'll talk about pathways. And then we'll talk about what we at the ARC have been doing and what we're continuing to do, and then what those next steps are. So with that being said, let's go ahead and get started. So I want to start with some of those universal issues when it comes to waivers. And a part of that is understanding the process of how waivers actually work. So all states are allowed to have what are called home and community-based services. Those are the formal name for Medicaid waivers. And when a state wants to provide waiver services or those home and community-based services, what they do is they write a comprehensive plan and they submit it to the Centers for Medicare and Medicaid Services, often called CMS, to approve that. Basically, when a state wants to provide home community-based services, they have to ask the feds permission to do that. And they have to get approval of that plan from the feds in order to be able to provide those services. Well, when a state writes that comprehensive plan, they write it for either 3 years or for 5 years. Indiana tends to do 5 years at a stretch when we do our waiver services. And the reason that's now, if they want to make changes in the midst of that 5 years, states can always submit amendments to that plan to be able to make those changes. But the reason this is important is we've had a lot of people say, hey, wait a second, there is so much chaos right now. Let's just put the changes on pause and come up with a better, more comprehensive plan and then move forward. And this is one of those times where I'm going to tell you that, believe it or not, we couldn't. And the reason I say that is because the traumatic brain injury waiver and the aged and disabled waiver actually have an expiration date. They expire on June 30th, 2024. And so if we were to go past that and we didn't have anything else available, it's not that the current A&D waiver or the current TBI waiver would continue until we had something new. It's that once we hit that expiration date, the state would no longer be able to provide those services, period, and everything would stop. That's why we couldn't just put this on pause and work this out better. It's that we had to have something new in place so that we could keep moving forward. But what that also means is we can still submit amendments later on to keep improving the plan that has already been approved. The other thing is we have that plan that CMS has approved, and now the state's going to go through and make what they call program manuals. And so sometimes we can also have clarifications or adjustments that are made in those program manuals as well. So we have legislation, we have the state plan or the waiver plan that's approved by CMS. Then we also have those program manuals or the waiver manuals, which give us information. And depending on what kinds of changes we want to make, depends on which level we need to adjust. And so adjusting the program manual or the waiver manual is by far the easiest. Adjusting things with CMS and submitting a formal amendment, it's formal, so it does take a effort, but that is certainly easier. Legislation is something that most people immediately gravitate toward, but that is by far the most difficult way to actually make some changes. So we've got we've got some flexibility in how we do some of these things, and we're going to keep working on those. One of the other overarching things that I want to talk about tonight is about compliance, because that is what is driving a lot of these changes. So one of the big issues was that Indiana had been making certain things flexible and had been allowing individuals and families and provider agencies to do things that didn't necessarily align with the plan, the waiver that was approved by CMS. And now we're getting in trouble for that. And so one of the things that I am seeing is that, first of all, states have to comply with the plan that was approved by CMS. They have to. And one of the things that I am starting to see is that the state is just being stricter in their interpretations of things where they had provided flexibility in the past. They're not providing as much of that flexibility as they have before. And so we're starting to see a lot stricter compliance measures to make sure that everybody is following all of the rules. I will also say that a lot of times for individuals and for families, we think of things as just one thing, when we're caring for a loved one, we think of it as, oh yeah, I'm just caring for my loved one. But in reality, there could be several different services that a person may be using in order to do that. So we may merge together attendant care and home and community assistance and PA nursing, thinking of it all as one thing in our minds because there's a lot of overlap with all of that. But it may actually be several different services. And so that's why that compliance piece is a lot more important, is because the state's going to get stricter about that. So for example, technically speaking, when you are billing for attendant care, you're not allowed to give medications to someone. Most people did that because it was their loved one, and so they were just taking care of them. Technically, you are supposed to clock out in order to, feed them through their G tube or give them their medications, or something along those lines. And so we're going to see a lot. I think we're going to see more stricter compliance with some of those issues from the state. And so I kind of want to make sure people know about that, to think about that. And then one of the other universal issues that we're dealing with involves Medicaid PA, and that PA stands for prior authorization for various services, and especially for home health or nursing services. Here's the reason this is important. Prior authorization typically refers to something that is part of the Medicaid state plan. That's the official name for it, is state plan. To any regular person, it's the Medicaid health coverage. It's the Medicaid health insurance. All right. And one of the things is that you are supposed to use state plan services first before using home community-based or waiver services. That was always supposed to be the case. That was one of those things where the state didn't necessarily enforce that very heavily. We're starting to see more of that now. One of the things we're hearing from a lot of families is that their case manager is telling them that they have to apply for PA first. That's okay. Don't let that freak you out. It was something that we were always supposed to do. Like I said, it just didn't, it just wasn't enforced very often. And so one of the things is that they may say that you need to apply for PA home health or PA nursing services first before you start using other services. I also want to point out that with those PA home health services, it is still possible for a legally responsible individual or others to get paid to provide PA home health services. Now, in order to do that, they have to meet all of the regulations involved. So first of all, they have to have the right training or certification. So if your loved one requires an actual nurse, you have to be a nurse in order to get paid through PA to care for them. But a lot of individuals simply require a home health aide. That does require about 75 hours of training, or at least that's my understanding, is it requires about 75 hours of training to get trained to be able to be a home health aide that can serve through Medicaid PA. I know that we actually have a webinar that we did back in February with Evan Reinhardt from the Indiana Home and Hospice Health Association. I just screwed up the name of that organization. But if you were to look on our YouTube channel, or if you went to the ARC's website, at arcind.org, and you went to our waiver changes page, which there's a banner with a big red button right up at the top that you can click there. You'll find that webinar there so that you can watch that as well. So you can learn about if becoming a home health aide through Medicaid PA is something that is feasible for you. And so I want to check the questions really quickly to see if we have some of those overarching ones. Somebody was asking, do I know if FSSA held their webinar yesterday? Everyone I know could not access it live, so I wonder if it happened. I've got to be honest, I was actually at a conference yesterday and I wasn't able to watch it live either. The good news is Medicaid has been, or FSSA and DARS specifically, has been really good at posting those very quickly. So if that recording hasn't already been posted, I would actually expect it to be posted tomorrow because they've been really, really good about that. Let's see. So I've got a few more questions that are going to wind up being involved with some of the other things that can be answered later. So in some of the other sections, I do see one person asking, but will PA require being done in your home or can it be done in the community? If it's required to be done in your home, it makes you more homebound. And I do believe, and this is something where I can't swear to the answer, I do believe that generally speaking, home health services do need to be provided in the home. It's not like, your home health aide can take you to Target to go buy toilet paper, or at least that is my understanding. Like I said, I can't swear to that, and that's something that I will double check on. And I wasn't joking because literally I have a pad of paper here so that I can write down the questions as they come across or as they come along. Okay. Um, so let's see. So now let's start talking about the family supports and CIH waivers. One of the important things to know here is that this is an amendment. The family support waiver and the CIH waiver expire next year. And so they will start rewriting those waivers later this year in order to be ready for that. One of the things that I keep coming across is that there has been so much discussion about who can be a paid caregiver and how and all of that. And there's been a lot of confusion over which waivers that actually affects. And so one of the things I want to clarify is that there are no changes on who can be a paid caregiver for the family supports waiver or the CIH waiver. And before anybody gets upset about that, it's because they've already had these restrictions in place. So the parents of minor children and spouses really normally were never allowed to be paid as caregivers on the family support and CIH waiver. There was an exception specifically during COVID, during the public health emergency, and that was actually addressed through something called Appendix K. And those Appendix K flexibilities ended on November 11th, 2023. Other than that, those legally responsible individuals were never able to be paid. The legal guardians of adults can be paid as caregivers. They've had that 40-hour-a-week limit since around 2010. So that's why I say it's not a change. And in fact, the limits on relatives as paid caregivers is more strict on the CIH and the family supports waiver than it is on the health and wellness or the TBI or the pathways waiver, because there the cap is only for that 40-hour-a-week cap is only for legal guardians of adults, whereas on the CIH waiver, that cap applies to legal guardians, parents, step parents, siblings, step siblings, aunts and uncles, cousins, grandparents. Any relative is capped at 40 hours a week. That doesn't apply to the family support waiver simply because the family support waiver doesn't provide enough for somebody to get paid for 40 hours a week. So there are no changes to who can be paid as a caregiver under the family supports or CIH waiver. But There are some other changes that are coming to this waiver. First of all, the state has created a new priority category for individuals who are coming off of the health and wellness waiver. Right now, we have two priority categories. The individuals between 18 and 24 who have finished school can request priority status and start waiver services right away. And the second category is the children of active duty service members or veterans can request priority status and they can start services right away. And beginning July 1st, if somebody is coming off of the health and wellness waiver because they no longer meet nursing facility level of care, but they also have an intellectual or developmental disability that would qualify them for the family supports waiver, they can request priority status and start those family support waiver services right away. One of the other changes through this, and frankly through all five of the waivers, is that the state clarified that um, funding for vehicle modifications is capped at every 10 years and is no longer a lifetime cap. That's actually one of the changes they made. And when they submitted that plan to CMS in January, there was confusion because in some places it said it was a 10-year cap, in other places it said it was a lifetime cap. And so the state did clarify and did correct the submission they made in May to CMS to clarify that it's a 10-year cap. So every 10 years, if you need a vehicle modified, you can try to use your waiver services to modify that vehicle. One of the other changes is that they created a service called home modification assessment. So we do have some individuals who need to modify their home. Right now, it's called environmental modifications. One of the other changes is that they're changing the name to home modifications. So for example, if you need to make your bathroom accessible, or if you need to put in a stair lift so that you can get upstairs, or you need to widen doors, or if you need something to make your home more accessible, that is potentially something that you can use your waiver for. And what they're now doing is requiring that you get a home modification assessment from a separate company to make sure that the home modification is feasible and to create an appropriate plan that can be submitted for the waiver. One of the other changes is that now, under some very limited circumstances, if an individual is in the hospital, it may be possible to still use residential habilitation services while that individual is in the hospital. There are a lot of rules with that, especially making sure that there's no duplication of services and all of that. But one of the things that we were seeing is that sometimes when an individual with an intellectual or developmental disability was in the hospital, well, the nurses and the other hospital staff are trying to assist all of the patients on that floor, and we may have somebody who needs more of that direct interaction and more of that direct support beyond the nursing side of things. So that's one where it's going to be really important to look at the program manual or the waiver manual once it's published to find out exactly what those limitations are and how somebody might be able to access this. I do think it's going to be something that's rare, but it is one of the changes that was approved. There we go. But some of the biggest changes with the family support waiver and the CIH waiver involve employment. And really the state is looking to ensure that people with intellectual and developmental disabilities are able to work and to have the supports that they need in order to work if they want to. And so, for example, they have created a new service called Career Exploration and Planning. They've added flexibilities into four other services to help provide some of those employment supports. So if somebody is using behavior management services, but they need some support in how to actually interact appropriately in the workplace, or how to manage their behaviors or their stress or something like that in the workplace, behavior management can now be used to help work on those types of needs. They've also added some additional flexibilities into a service called extended services, pre-vocational services, and workplace assistance. Now, it's important to know that these waiver services are not supposed to duplicate anything that you can get through VR or through the Rehabilitation Act. They are not, and frankly, you should be using any services through VR or that are authorized through the Rehabilitation Act. You should be using those first before you use those waiver services. But they've now added that flexibility in so that, let's say somebody has worked with VR, they've gotten a job, their job has stabilized, and VR services have faded away, but maybe they need somebody to kind of come in every couple of weeks or every so often just to kind of check in on them and make sure that things are still going well, or to be able to have somebody that they can talk to about things that they may be having difficulty with in their workplace. Now those waiver services are able to help, are there to be able to help them address those needs. But a couple of other changes that are really important when it comes to employment involves pre-vocational services and specifically sheltered workshops. If you're not sure what a sheltered workshop is typically a facility where individuals are working, oftentimes in manufacturing, although not exclusively in manufacturing, where individuals are paid less than minimum wage or sub-minimum wage is how you'll always see it written. Um, Sometimes it's often also called piece rate. So if you've ever heard the term piece rate, that means that that individual is likely getting paid sub-minimum wage. They're getting paid for every piece that they complete. And starting July 1st, individuals between 18 and 24 can no longer engage in sub-minimum wage employment at all. Now, this is a change, but this is more of a slight change because there was a federal law passed in 2014 called the Workforce Innovation and Opportunity Act, or WIOA. And one of the things that did was it limited when an 18 to 24-year-old could actually work in sub-minimum wage employment. It was trying to interrupt that school to workshop pipeline. And so now, effective July 1st, any individual between 18 and 24 will no longer be allowed to engage in sub-minimum wage employment. But one of the other big changes is that anyone who's using pre-vocational services, which is often what is billed for sheltered workshops or sub-minimum wage employment, pre-vocational services will be capped at 18 months starting July 1st. Now they're not going back retroactively. What they're saying is from July 1st on, an individual will only be able to use pre-vocational services for no more than 18 months. And if you're wondering about this, yes, this is leading up to the closure of sheltered workshops. And I know that scares a lot of people. We've been having these discussions for well over a decade at this point. In all honesty, a lot of sheltered workshops have already closed or have already transitioned to other services. And all sheltered workshops at this point know that this is coming. And so they have been working on plans for what their transition is going to look like. And they look like a lot of different things. So we have some sheltered workshops who just started paying everybody minimum wage. And that alone, took care of the issue. We have other workshops where they are adjusting to different services. So, for example, there are a few who have opened up coffee shops or up in Elkhart, a popcorn shop. I'm thinking of Wabash, where one of the things they've traditionally done is a lot of paper and cardboard recycling. Well, one of the things they're doing as part of their transition plan is they've gone out and they have bought shredder trucks. And so part of that is to then get those individuals out in the community more, so that they're engaging with more individuals who do not have disabilities, and also getting them to the point where they're actually making at least minimum wage. So that is one thing that is on the horizon, and I wanted to make sure everybody knew that too. So now I'm going to stop again and look at questions to see what questions may have come up since then. Um, so, so forgive me as I'm going through these. Um, so somebody did ask, does FSSA recognize that if the member is not eligible for PA home health, it makes no sense for PA to be applied for? This is one of those times where I'm going to tell you, don't apply logic to government programs. Logic and government don't like to work and play well together. In all honesty, a lot of times sometimes what they need, and whether this is for PA home health, whether this is for PA medical equipment, whether this is for certain medications, sometimes what they need is they need that a formal denial so that they can check that box off so that then you can use your waiver services as you need to. But sometimes a big part of that is making sure that you actually got that denial so that they can move forward. Um, so, um, so my son just received notification that he can begin to receive waiver services. We've waited for 3 years, which is how I know we're talking the family support waiver. His condition is worse. Can we get more services? Um, One of the things I'm going to say is we need to start first by using what's available, and especially when it comes to somebody who wants to apply for that CIH waiver, because that's a really, really common thing that we get questions about. One of the big thing is that first of all, the state's going to want to make sure that you're actually using all of the services that are available to you, and that you're looking beyond just waiver services to see if there are some other services, maybe not through the Bureau of Developmental but from the Bureau of Disability Services, but through some other programs that could be available to help, or basically they want to see that you've tried some other things first. So I'm not saying it's not possible. What I'm saying is you've got to build your case and show that you've been trying some other things first, that you're using all of the services, especially all of the services available through the Medicaid health coverage or Medicaid state plan, to help you make your case for that. So, all right. So now let's talk about the TBI waiver. Um, so one of the big changes with the TBI waiver is that it is being moved from the Division of Aging to the Bureau of Disability Services. You just heard me slip up a minute ago, and it's going to be a while before I get this straight. Last year, the Bureau of Developmental Disability Services was renamed the Bureau of Disability Services in anticipation of taking over the TBI and the Health and Wellness Waiver. Still referred to as BEADS because it's just one D instead of two. But that's one of the big differences, is that it's going to go from Division of Aging to the Bureau of Disability Services. And I know because I've talked to a lot of families of individuals with traumatic brain injuries, there's some concern over that. And this is one of those times where I think this is actually a good change, because I think the Bureau of Disability Services has a better understanding of some of the needs for people with traumatic brain injuries, especially some of the cognitive needs, some of the social needs. I think they've got a better understanding of that than maybe um, people who mostly work with older adults. So this is something I'm optimistic about, but I think that they may actually have a better understanding. Um, Now, with the TBI waiver, you are still going to go to your local area agency on aging to apply for that. Um, but one of the other things is the Bureau of Disability Services is going to start using the life course framework with individuals. Life course is a philosophy, basically to help people figure out, what is it that they want in life? And just as importantly, what do they not want in life? But what do they want in life, and how do we help them get there? What other resources do they have, including their paid services, but beyond just paid services, that can help them achieve what it is they want in life, and really kind of looking holistically at the person. One of the things you will be doing is you will be creating a person-centered service plan. Here we've got a name change more than anything else. But really, one of the big things is that they are trying to be very person-centered as they develop these things. Your care managers can still be your care managers. I always thought it was funny that the TBI waiver and the aged and disabled waiver used the term care manager, and the developmental disability waivers always used case manager. So I always catch myself on that. Again, that vehicle modification is a 10-year cap. They created that home modification assessment so that there's an independent group who is looking at that home modification request. But one of the other big things with the TBI waiver is that neither legally responsible individuals, and in this case, for home and community-based services, when they say legally responsible individuals, they are referring specifically to the parents of minor children and spouses. That's what they mean by legally responsible individuals. But neither legally responsible individuals nor legal guardians can provide home and community assistance, which was one of the formal names for homemaker services, is really what that was referring to. Now, one of the biggest things is that there's a lot of confusion when it comes to attendant care. And in all fairness, the confusion is warranted. I mean, it's justifiable. But it's important to know attendant care is not going away. That's one of the rumors that was out there. Attendant care is not going away. What's changing is who can be paid to provide attendant care. Starting July 1st, those legally responsible individuals, meaning the parents of children under 18 or spouses, cannot be paid to provide attendant care. Any other relative can provide attendant care. That's not a problem at all. And legal guardians of adults can provide attendant care, but they are capped at no more than 40 hours per week each. So if you've got two legal guardians, you've got mom and dad both as legal guardians, mom can get paid for 40 hours a week, dad could get paid for 40 hours a week. So that's one of those things I wanted to clarify as well. But attendant care is not going away. If you actually know somebody who may be able to provide attendant care for you, grandma, aunt or uncle, cousin, adult sibling, because you have to be at least 18 in order to be a caregiver, you can use them to provide attendant care for you. But I know a lot of families weren't wanting that. The parents wanted to be the ones who were the caregivers. And now a parent of a child under 18 will no longer be able to be paid for attendant care services. And that's what the big change is. I will also say that they did clarify that under attendant care, you can now assist with mobility devices, specifically Hoyer lifts. Believe it or not, previously you were not allowed to do that. Almost everybody did, but you weren't supposed to. You were supposed to clock out to help your loved one. But that has changed effective July 1st. There have also been a lot of rumors about hour cuts. And that's one of those things I wanted to address as well, because we're not actually seeing hour cuts at this point. But I understand where the rumors were coming from and where the fears coming from. And so I wanted to take some time to talk about this. So one of the things that happened was that a lot of times when a case manager submitted a new care plan, it would be automatically approved. You know, there was an automatic renewal. Well, one of the things that happened within the last few months was that the state went through and required manual reviews of all plans that had more than a certain amount of attendant care. I think it was 240 hours. If you had more than 240 hours of attendant care per month, you had a manual review. Or if you were a child under 18 who had more than 80 hours of attendant care, you did a manual review. And what I meant by manual review was that an actual human being looked at the plan to make sure that those hours were justified. So that's where a lot of the fear about cuts were coming from. That and the fact that, well, we've now got $1 billion Medicaid shortfall. So that's part of where it was coming from too. But they were doing those manual reviews. One of the other things that is happening right now is that the state is also telling people, hey, you got 240 hours of attendant care, but you should also be trying to access that PA home health first. And so one of the things that I anticipate, but I'm not necessarily seeing happen quite yet, and that may just be a timing issue, is that, for example, let's say we've got an individual who is approved for 120 hours of attendant care per week. Well, but they're only approved for attendant care. They haven't even tried to access PA. One of the things that I anticipate is that, you know, with, with mom and or dad working, they may get approved for, 40 or 50 hours of PA home health, 40 hours because that's, what mom and dad work plus, an hour each way for commute. So let's just say 50 hours of attendant care per week. And then that attendant care may get adjusted to reflect that you're getting 50 hours from home health. So instead of 120 hours of attendant care, one of the things that I can see happening is you get approved for 50 hours of PA home health and then 70 hours of attendant care. So it's still 120 hours. It's just broken up differently. And one of the reasons that they will do that is because the state is actually reimbursed from Medicaid, from the feds differently when it is state plan services or Medicaid health coverage services versus home community-based services. So that's one of the reasons that we may see that. I know that that is not universal. I know that will not work for everyone. I get that, but I wanted to explain that is something that I anticipate seeing. It may not happen, and it may not happen in every case, but that's one of the things that I'll be looking out for, especially as we make this transition over the next few months. One of the other things that I want on people's radar is that basically FSSA is going to put part of this back on the school systems. The school systems have been shirking their responsibilities and putting it all on FSSA. FSSA is now going to be pushing back and saying, hey, school system, you are required to provide an education to this student during school days. And if they need nursing services or if they have a need, you are required to provide that. Period. End of story. Now, we know that that doesn't normally happen, but that is still the legal responsibility of a school corporation is if a student needs something in order to be able to access their education, the school system is required to provide that. And so one of the things I'm concerned about is basically our kids getting into a game of hot potato between FSSA and the school systems. It's something I'll be watching for. I'm not saying it will definitely happen, but I want that on people's radar to know that that could be another reason why FSSA may reduce attendant care hours is because they expect the school system to actually step up and start fulfilling their responsibilities as well. So then one of the things that is happening is that the state is really encouraging families to use something called structured family caregiving. Once upon a time in the developmental disabilities world, structured family caregiving was referred to as adult foster care, just to kind of give you a better idea of what that means. Now, no one has to move to structured family caregiving, okay? But keep in mind that if you are a legally responsible individual, structured family caregiving is the only way you can be a paid caregiver effective July 1st. You don't have to move to structured family caregiving, but if you do, you need to do it now. And when I say that, I mean, if you have submitted that transition plan by June 15th, it makes things a little bit easier. Literally, that's Saturday. Tonight's Thursday. That means if you are going to do this, you need to do it tomorrow. And the reason for that is if the plan is submitted before June or by June 15th, the state will use the current level of attendant care hours that the individual is approved for to determine which level of structured family caregiving they qualify for, whether that's level 1, level 2, or level 3. If you don't submit that transition plan by June 15th, and you decide, in August, yeah, I really need to go to structured family caregiving, you can still do that. Don't get me wrong. But what's going to happen is they're going to do a new assessment to determine what level your loved one would qualify for. And the biggest difference there is that it's going to take longer. The process will simply take longer. So it can take a few months to get everything done and in place for you to be able to start providing structured family caregiving. One of the other issues with structured family caregiving is that there is no pediatric tool for structured family caregiving at this time to determine what level a child should be. The state is going to develop a tool over the course of the next year. They will start using it July 1st of 2025. But for right now, if you do it before June 15th, they're going to look at your attendant care hours. If you do it after June 15th, they're going to use the standardized assessment tool that they have, which really is geared more toward adults. Like I said, structured family caregiving can be provided by legally responsible individuals. It can also be provided by foster parents. That is one of the other changes that was put into the May 3rd plan. And when I'm referring to the May 3rd plan, what I mean is the state submitted their initial plan to CMS in November. Public comment was due by December 14th. They submitted that new plan January 17th with public comment due February, I think it was February 16th, but I'm pulling that off the top of my head. They took the public comments, they took the feedback that they were getting, and they continued to make some changes and submitted a final plan to CMS in May. I think it was May 8th. It was May 3rd or May 8th. But they submitted that in May, and the Centers for Medicare and Medicaid Services, or CMS, formally approved that plan or all of those plans on June 4th. So they continued to make some changes as a result of all of that, and we're talking about those changes that have been finalized and approved by CMS now. So legally responsible individuals can provide structured family caregiving. Foster parents can provide structured family caregiving, and a lot of others individuals can provide structured family caregiving if they want to. Structured family caregiving does require caregiver coaching. And it does require that the structured family caregiving provider offer up to 15 days of unskilled respite per year. By the way, this is the only way that you can get caregiver coaching on the traumatic brain injury waiver. It is not a separate service. And skilled nursing respite has now been approved as a separate billable service. That is one of the other changes that that the state made based on the feedback that they were getting. And transportation can now be a separate billable service when doing structured family caregiving. So at this point, I know we've gotten a bunch more questions, and so we're going to come through and try to answer those. I've heard that they've been redoing plans of care for everyone, despite the fact that budgets do not expire until later this year. That's where those manual reviews were coming in. It's not necessarily that they were doing it for everyone. They were doing very specific targeted services and services over a certain amount. So it's not that they were doing it for everyone, but they were doing it for a lot of people. And they were manual reviews. And so one of the other things is that as this transition moves forward, if you have a care plan, either through the current aged and disabled waiver or through the current TBI waiver, those plans are supposed to stay in place for at least 90 days after July 1st. So they are not supposed to change until at least October 1st. Now you can add services to it. So if somebody's health gets worse and they need some more help, they can do that. But for at least 90 days, they are not supposed to reduce services at all. Let's see. Somebody asked the question, how is this legal? And I'm not sure what they're referring to. If you can give me some more information, I will gladly answer if I can. But I also want to say, don't get me wrong, I understand your frustration and it is, it's justified. Um, so in regards to the PA, a member cannot submit the request, though. A provider has to. You're right. It has to come from a home health agency, and the doctor has to sign off on it as well. So there is no incentive for a home health company to put the request together knowing the member's not eligible. My concern is that there are some companies that will submit with creative language, i.e. fraud, but that would make the member complicit in doing so. Can you raise the issue with FSSA on our behalf? Absolutely. So yeah, um, yeah, that's absolutely something that we can raise with them. And try to figure out, how are people supposed to navigate that? Um, let's see. Are homemaker services available under any other waivers? Homemaker services are available under the traumatic brain injury waiver, the health and wellness waiver, and the pathways for aging waiver. Uh, so, what is the name of the planning document that the state is going to use to help people identify what they want in life? It's called Life Course. And if you go to lifecoursetools.com, they've got tons of materials. They've got all sorts of tools. They've got all sorts of videos showing you how to use those tools. We at the ARC, through the ARC Academy and through our YouTube page, we've got different videos that are specifically about Life Course and how to use Life Course. But then we also work it into a lot of our other webinars as well. Um, I'm not familiar with PA home health. Can you explain that? Absolutely. So PA just stands for prior authorization. There are certain times with any type of health insurance, whether it's Medicaid or whether it's private health insurance, where you have to ask permission for that service. And so, for example, let's say you've got private health insurance, you have a child who needs speech therapy. Well, that speech therapist is going to create a plan of care and submit that to your insurance company to get permission to provide those services. That is called prior authorization. That health insurance company or Medicaid is giving prior authorization, and oftentimes it's for 6 months at a stretch to get those services. That's what PA stands for. PA home health is referring to having either a home health aide or a nurse, depending on your level of need, come into your home to help provide services. A lot of times, you would get PA home health while a parent is working or going to school. That's the most common way that somebody could qualify for PA home health is that while mom or dad are working, a home health aide or a nurse can come in to take care of the individual while the primary caregivers are away. There are some other ways that can happen, especially when you've got a family with several young children. There are certain ways that you can do that though as well. So that's what home health, that's what PA home health stands for, and because of how this service is provided, it's provided by Medicaid health coverage. And so that way it's coming out of the health coverage side or the state plan, and it is not coming out of a waiver budget. And that's really kind of the difference there. What happens if those PA hours cannot be fulfilled, though? There's still a major staffing shortage. You are absolutely right. And this is one of those times where don't hate me because I can't answer that yet. And I don't, it's because I don't think that they have actually developed an answer yet. And those are some of the things that we are trying to um, to get the state to drill down on and kind of come up with some of those plans and some of those contingencies in those cases. So you're absolutely right. I agree with you 100%. And that's something that they have to address it. Somebody is also asking because we brought up the point that FSSA is really going to turn back to the schools being fulfilling their obligations here. And somebody asks, is that the same if the child is homeschooled? If you've got a child who is homeschooled, um, here's where we get into some interesting things. So technically speaking, if a child is in a private school, um, the local school system is still supposed to provide some educational services and supports. If a child is truly homeschooled, you can still get certain related services, and a lot of times that's referring to like speech, OT, PT, um, through your local school corporation. But if you're really wanting to homeschool, one of the things that you can look into now, and this is relatively new, it's only been around for I think 2 years now, are something called education scholarship accounts. And in fact, there's a deadline for when those applications have to be in. But the education scholarship account, what it does is it allows families to I'm going to say this in an easier way to understand, but it's not technically correct. So I want to warn you that. Basically, it allows families to divert the funding that a school system would get to educate your child, and it would allow the family to be able to access those funds to provide an education in another way. It's not that the family gets the money directly; it's that money that the school system would normally get is put into an account with the state treasurer's office, and then you are able to use those funds with providers contracted with the treasurer's office to provide whatever supports that child need. Sometimes that's going to be things like private school tuition. Sometimes that can be things like therapies. Sometimes that can be some other educational programming, like, buying the Orton Gillingham curriculum or a lot of other things. But you can always look up education scholarship accounts through the Indiana State Treasurer's Office to learn a lot more about that. Um, is there a source to understand the difference between structured family caregiving versus attendant care? Yes, absolutely there is. And in fact, on our website, arcind.org, we have a page dedicated specifically to the waiver changes. And one of the materials that we have put together one, the state has put together a few that really help compare structured family caregiving versus attendant care. So you can find it there. You can find the state's materials specifically on their Medicaid strategies page. So if you were to Google Indiana Medicaid strategies, you'd find that site. But if you go to the ARC's website and look at our waiver changes page, we absolutely have that material there. Um, As an adult who isn't a dependent anymore, but still needs to have some caregiving needs, should I wait to fill out the forms past June 15th if I want to be more adult focused? If you know that you really need to and want to switch to structured family caregiving, I'd go ahead and do that now, just because that's going to help streamline the process more. You can wait if you choose to, but if you do it literally tomorrow, it'll make the process go a whole lot faster. Um, some more questions came in on the family support waiver and CIH waiver. Can someone on a family support waiver be in a group home? So a group home means something very, very specific to the state. A group home is an intermediate care facility for the developmentally disabled. And it is technically an institutional setting. So you cannot have a waiver and be in a group home at the same time. It's either or. However, most people tend to use the term group home when they really mean a waiver home, which is where you have, you know, up to 4 people who are living together in a house and kind of sharing services. If that's the case, can somebody on a family support waiver do that? They can. It's a little harder to find and to arrange, and part of that really depends on the independence of the individual. But that's something that's a little bit more nuanced. We do have individuals who are, living in apartments on their own, and who are using, their family support waiver, but then they're also using some other services like PA nursing or like things like a Ring doorbell or some technology pieces that can also help them live more independently. So it is possible for somebody on the family supports waiver to live on their own or to live with housemates. It's a little bit, it's a little bit harder or a little bit more challenging, and you've got to, you've got to do a lot more planning to make it happen. But you can absolutely do that. Um, so. Um, oh, somebody asked, what makes someone eligible for MPA? And please don't kill me on this one. I need you to define MPA for me because at this point I am on alphabet soup overload and I'm trying to remember what MPA stands for and it is escaping me. So if you could tell me that, I will gladly answer you. Um, Can a parent provide PA home health for their own adult child? It is possible. Part of that depends on whether or not whether or not they meet the requirement for getting PA in the first place. So for example, if mom is wanting to provide PA and dad's working, yeah, that should be possible. The second thing is you also have to meet the provider qualifications for it. So, for example, if your adult child has to have a nurse who's providing their care, you have to be a nurse to be the one to be paid for that. If, however, your adult child only needs a home health aide, you can become a home health aide. In fact, there are some companies right now who are starting to specialize in training people and parents specifically to be home health aides in order to do that. And from what I have learned, it normally requires about 75 hours of training to be able to become a home health aide. So I don't think that that's a hard and I'm not sure that that's a hard and fast rule. There could be some differences there between providers, and then the state also has certain requirements for what they require in order for somebody to be a home health aide. And you do still have to go through a home health agency, so it's not like you can just do it completely on your own. You've got to go through an agency. But those agencies would talk with you about how to do that. And frankly, if there's a way to pull it off, they're going to try to make that happen because that's how they get paid too. Uh, So somebody's asking about how hours roll over. And so I'm glad you asked that question. That's something that a lot of people don't even think about. So there are certain services that are use or lose by the end of the month. So when somebody is on home and community-based services or on waiver services, typically those services are approved, for a month at a time. Okay. I mean, don't get me wrong, it's for the entire year, but they're laid out, you have this many hours in January, this many hours in February, this many hours in March. There are some services that are use or lose by the end of the month. There are some services that roll over every quarter. So if you don't use your hours in January, you can still use those hours in February and March. But if you haven't used them by March, they're gone. Then you have certain services that are use or lose by the end of the year. I don't have a comprehensive list, especially for the 5 different waivers now. I don't have a comprehensive list of which services use or lose by which time, but that's something to talk with your case manager about so that you are able to make more effective planning and so that you are able to make sure that you are maximizing your loved one services to the greatest extent possible. So have that conversation with your case manager. Uh, let's see. Are education scholarship accounts available for adults who aren't dependent anymore? No, education scholarship accounts are only available for students between I think it's actually age 5 and 22. It could be 3 and 22, but I think it's 5 and 22. So they have to be school aged because there are a lot of requirements for that. Um, so, and with those education scholarship accounts, I know that the state treasurer's office has really, they have put together some webinars to help explain education scholarship accounts. So I'd really encourage you to go to the state treasurer's office's website or just Google Indiana education scholarship accounts so that you can learn more on those. Um, let's see. Okay. Somebody's asking, can Medicaid and or waivers pay for Ring cameras and or the yearly video storage cost? One of the things I'm going to say is that, especially with the family support waiver and the CIH waiver, they're going to be rewriting those waivers later this year. And this is something to absolutely bring up so that we can get an amendment for that. I'm also writing that down. So, okay, okay. How do I find my case manager? Oh, so you should be meeting with your case manager at least once every quarter. They are required to do in-person visits. Um, and even when somebody is living in their own home, they're required to come to the home at least once a year. So not knowing which waiver you're on, I can't tell you who a case manager might be. If you're on the family support or CIH waiver, it's going to be either IPMG, Connections Case Management, Inspire Case Management, the Columbus Organization, Unity of Indiana, and this is embarrassing because I'm totally forgetting the 6th company. That is awful of me. Um, Nope, I am totally drawing a blank on who the 6th company is. But if you are currently on the aged and disabled or the TBI waiver, um, I know that a lot of the local area agencies on aging serve as case management companies, but I also know that they're not the only case management companies. So for example, if you're in the Indianapolis area, Socoa could possibly be your case management company. And if you're currently on the aged and disabled waiver, you can always call your local area agency on aging to ask them who your case management company is. They should be able to look that up and tell you that information. Okay. So somebody just added, is it only once a year that they have to do in-person meetings for the case management or because they were told it was twice a year. Um, I think especially because I know who you are, so I know which waiver you're going to, that is going to be at least twice a year in your case. CareStar, thank you so much. Oh my gosh, somebody's totally saved me, and I'm so embarrassed that I totally blew that off. So Thank you so much. CareStar is the sixth case management company for the family support and CIH waiver. And please know that, yes, I am blushing profusely right now. Oh my goodness. Okay. So we've talked about the family support and CIH waivers. We've talked about the TBI waiver. Now we're going to go on to the health and wellness waiver. So the health and wellness waiver is moving from the Division of Aging to the Bureau of Disability Services, but you're still going to go to the local area agency on aging to apply. They have started a waiting list for this waiver. And one of the questions that we are getting quite often is, how long is this wait list going to be? And part of the reason people are asking that is because they know that the family support waiting list is around 2.5 to 3 years right now. They're wondering how long this waiting list is going to be. And the answer is, we don't know that yet. And the biggest reason I say that is that, first of all, I don't know that we got a good handle on how many people have actually gotten on that waiting list. But the other big issue is, we don't know for sure when they're going to start taking people off of that waiting list. Don't get me wrong, their intention is to do that as quickly as they can. I don't necessarily think that's really going to be July 1st, although I don't know that for certain. I think they're going to take a little bit of time to make sure that they get this transition going and get things started with that transition before they start pulling people off of the waiting list. But we don't have a definitive date on that yet. Okay. The other thing is, if your care managers on the health and wellness waiver are still going to be the care managers, or your care managers on the aged and disabled waiver are still going to be the care managers for the health and wellness waiver. So, because I know that there were some people who thought that since the health and wellness waiver was moving over to the Bureau of Disability Services, that you would have to use a Bureau of Disability Services case manager. That is not the case, at least right now. You can stick with your case manager or your care manager if you like them. If you want to change, you're totally welcome to change too. Okay. That is one thing I also want to stress here, is that when you have a waiver, you choose which services you use, and you choose what agencies provide those services. And if you want to change, you can change. Now, one of the other big changes with the health and wellness waiver is that it will now only be for individuals under age 60. So age 0 to 59 can be on the health and wellness waiver. And once you turn 60, you will be transitioned to the pathways for aging waiver, which I will get into next. Health and wellness is also going to use the life course framework to really make sure that things are person-centered, and that we're looking kind of holistically at people. The information about attendant care and structured family caregiving and home and community assistance is the same information as for the traumatic brain injury waiver. So all those things that we just discussed also applies to the health and wellness waiver. However, caregiver coaching is a separate billable service under the health and wellness waiver, just on its own. With the TBI waiver, you have to be using structured family caregiving to get caregiver coaching. That is not true with the health and wellness waiver. And I learned in February, when these waiver changes were announced, and we were doing some webinars on the proposals back then, caregiver coaching is controversial. I was not expecting that. And I had some parents who, quite frankly, were really insulted at the idea of caregiver coaching. You know, they're like, this is my child and nobody knows how to care for my child better than I do. I agree with that. Okay. But, and I think part of it is I view caregiver coaching with a different perspective, because for me, you know, when I think about caregiver coaching, one of the things that I'm thinking of is, if your loved one maybe develops a new condition, or maybe something changes, or frankly, they start puberty. And I roll my own eyes as I say that, except it is a real thing. But you know, if something were to change, having somebody you could talk to about that could be really helpful. So if you have a loved one, you know, who has all sorts of uh, disabilities and conditions and all of that, and then they suddenly develop diabetes on top of all of that, wouldn't it be helpful to talk to somebody to figure out, okay, Now, how do I incorporate that into our lives too? Or if somebody suddenly develops seizures, or frankly, they're just 16 and all of a sudden we're starting to have behaviors and we're starting to have more aggression because they don't communicate verbally, and so their frustration level is off the charts, and so we're starting to see more aggression. To me, it's helpful to be able to talk to somebody about that and figure out, okay, how do I incorporate all of this into my life? So to me, that's what caregiver coaching is about. I don't want to diminish anyone's experiences, and I don't want to disagree with anyone. I guess I just have a different perspective. But just because caregiver coaching is available doesn't mean you have to use it. You choose what services you want to use, but that is one that is available. Um, One of the other differences with a health and wellness waiver is that self-directed care is actually an option with the health and wellness waiver, and it has been for a while, but they are planning to expand self-directed care through amendments in 2025. The state has specifically said that. One of the other questions that we were getting back in February when we were doing our webinars and public comment period was open for that second submission was, where do these public comments go? Will we ever see those public comments? Well, in the waivers that were approved by CMS on June 4th, those are available on the Medicaid strategies page. You can actually look at those. And one of the things they did was now they summarized, but they summarized the public comment that they got for both the first public comment period and the second public comment period. And then they also gave the state's response to those public comments. One of the things, if you read the health and wellness waiver, you will find out that they received more than 2,000 public comments specifically about the legally responsible individuals provisions for the health and wellness waiver. So you can actually see public comment in the submission, in the ones that were approved by CMS on June 4th. One of the other changes with the health and wellness waiver is that they did create a new priority category so that if an individual who also has an intellectual or developmental disability, if they were to stop meeting nursing facility level of care, they can request priority status to move to the family supports waiver. Now, that sounds scary. What I mean by that is sometimes we have children whose conditions improve. Maybe one of the reasons why they qualified for the aged and disabled waiver was because they had a G tube. Or maybe, they were on a ventilator or something along those lines, and they have improved enough that they have been able to come off of those things, which might mean that they no longer qualify for the health and wellness waiver because they no longer meet that nursing facility level of care. As long as they meet the appropriate level of care for the family support waiver, they can move straight from the health and wellness waiver onto the family support waiver without having to go onto the waiting list. So they now also, effective July 1st, will also have a priority category to start services. Okay, so now we're going to come back up and look at some of the other questions that have been submitted. I heard that if parents are 80 or deceased, then the child moves from the family support to the CIH waiver. Is this true? You got to fill out the application, but yes, parents over the age of 80 or caregivers who have passed away, those are qualifying criteria for the CIH waiver, which is now an emergency-based waiver. Let's see. Will it be possible to move from the family support waiver to the health and wellness waiver? And who determines which waiver you get? That's a great question. And part of it depends on what level of care you qualify for. And what I mean by that is when it comes to the family support waiver or the CIH waiver, First of all, you have to have an intellectual or developmental disability. And that had to be before age 22. So you have to have one of those. Then for the family support or the CIH waiver, they do an assessment called the level of care screening instrument, or the LOCSI, and they are looking to see if you meet intermediate care facility for the developmentally disabled level of care. That is a mouthful, which is why it's hard to say. Okay. But they're looking at things like mobility, um, use of language, self-care, self-direction, capacity for independent living, and learning. Okay, those are the things they're looking at there. To be on the health and wellness waiver, you have to meet nursing facility level of care. And so there they're looking a lot more at medical issues. And they use something called the PASSAR, which is a nationally normed tool that helps determine if somebody meets nursing facility level of care. If you are on the family support waiver and you also meet nursing facility level of care, can you move to health and wellness? You can. Um, if you don't meet that level of care, you would not be able to switch over. Okay. If you are on the health and wellness waiver and you stop meeting nursing facility level of care and you have an intellectual or developmental disability and meet that ICFDD level of care, you can move to the family support waiver, and you can always apply for the CIH waiver, but whether or not you get that is a different matter. But if you're on the health and wellness waiver and you stop meeting that nursing facility level of care and you do not have an intellectual or a developmental disability, you would not be able to move to the family support waiver or the CIH waiver. Um, is primary provider the same as care manager? Great question. No. So a care manager is someone who, um, oh, and please, my care managers and case managers on the webinar, please don't be mad at how I say this. They're the ones who are dealing with all of the administrative things. They're the ones who are dealing with all the paperwork, and they're the ones who are kind of acting like oversight to make sure that you are getting the services you are supposed to be getting. They're the ones who are making sure the providers are doing the things that they're supposed to be doing too. And then if they need help, then they can go to the state to get some backup on that. Um, Primary provider is the way I'm interpreting that question is the individual service providing agency. So for example, if you are using attendant care, it would be the primary provider would be the agency that you hire to provide that attendant care. If you're on the family support waiver and you're using behavior management, the provider would be the agency who's providing that behavior management service. So they are different. Um, Here's another great question. Do you know how it works with applying for Medicaid if the member doesn't qualify without the waiver? FSSA said Medicaid has to be approved before getting services, but being on the waiver qualifies you for Medicaid. So does a new waiver member have to apply for Medicaid separately? And if so, when would they do this and how? You have come across one of the chicken and the egg issues that we have, because which comes first? Um, and so yes, you do actually wind up applying for Medicaid health coverage and the waiver separately. Those are two separate applications. When do you do them? That's the question here. So if we are talking about a child under 18, if the family qualifies for Medicaid health insurance based on family finances, then just go ahead and apply for Medicaid. But if the child does not qualify for Medicaid based on family finances, you need to wait until that waiver has been approved, or you have been targeted, which is the term the state uses, meaning that your name has come up on the waiting list. That's when you would apply for the Medicaid health coverage. So for example, let's say we've got an 8-year-old child who is on the waiting list for the family support waiver. Family doesn't qualify for Medicaid based on family finances. We need to wait until he gets the letter saying he has been targeted for a waiver, and they will always send it by mail. Okay, so you want to always make sure that your address is up to date with the Bureau of Disability Services. Once you get that letter saying you've been targeted for the waiver, it also says, do you still want it? And you say yes and send it back in. Once you've done that, that's when you can apply for Medicaid health insurance. And you can go to indianamedicaid.com. You're going to click member services and or information for members. It's something like that. And then you're going to click apply for Medicaid or apply for coverage. When you fill out that Medicaid application, one of the things it's going to say is anyone in the household disabled? And you say yes to that. And that's going to create a new drop-down box that asks if they are involved in a variety of different programs. One of them is that they've been targeted for a waiver. When you click that, that's when it tells the Medicaid computer system, first of all, to ignore family finances, but it also tells them to use the special income limits of the waiver to approve their Medicaid health coverage. So you want to wait, especially if it's a child whose family does not qualify for Medicaid, or even if it's an adult who doesn't financially qualify for Medicaid, you want to wait until you can say that you've been targeted for the waiver. But if financially you qualify for Medicaid, go ahead and apply then. Okay, so that's a really, really great question. And yes, those are separate applications. My case manager is you saw me do a double take on this question. My case manager is requesting my son's birth certificate and Medicaid in order to transfer him to another provider, and that this can take up to 2 weeks to get approved. Does that sound right? Well, asking for his Medicaid number sounds right. And the fact that it could take 2 weeks to get approved, that sounds right. The birth certificate is the part that is giving me pause. I don't know why they would need the birth certificate, and that's something that I would ask, and I would ask that of the new provider. You know, because maybe we've got a miscommunication somewhere. To my knowledge, there is no reason you would need to provide a birth certificate to a provider agency, and the state would already have a copy of it. So I'm not sure why somebody is asking about a birth certificate. And as you can see, I'm writing that down because that's a new one on me. But wanting his Medicaid number, the case manager should be able to see that in their computer system too. So, but I'm also recognizing that sometimes because they like to mess with me is what it is. I'm being sarcastic here. Sometimes provider agencies will also refer to some of their employees as case managers, but they're not waiver case managers. So sometimes we've got some confusion with that. But the idea that it can take up to 2 weeks, yeah, that's easy. And especially right now, we're going to have a lot of changes. So things may take a little bit longer than normal right now. And I want to make sure people know about that. But I would talk to the new provider agency to find out if they are really the ones requesting birth certificates or not. I also know, because I have seen their questions on here, that we've got a couple of case managers who are also on this webinar. If you guys want to chime in with that, I would appreciate it. My attendant care agency keeps saying my attendant care hours will be cut to 40 July 1st. I currently have 112 hours. My plan does not expire until November. What's the plan best way to fight and keep my hours? Okay, so first of all, not that I'm trying to freak you out here, but thankfully your name is on here. So I can look into this a little bit more and get back with you. It is my understanding that there are not supposed to be any cuts July 1st, that all plans are basically, I'm going to say frozen in place. That's not entirely accurate, but plans are to stay in place for at least 90 days through this transition process. You can add to it. They are not supposed to make any cuts for the first 90 days. Now, after 90 days, they can potentially make cuts. That's why that's something that we're monitoring. Um, One of the other things that I would be asking your attendant care agency is what's the justification? Why are they saying that they're cutting you from 112 to 40 hours? Is it that they're expecting you to be able to use Medicaid PA because you've been approved for, you know, I would be shocked if you were approved for 72 hours of PA, but whatever the case may be. Are they expecting part of that to be covered by the PA home health? And if so, is your attendant care agency willing to cover that? Or what so I would talk with both your attendant care agency, but then also your care manager to figure out exactly why they are saying that. But I'm also going to dig into this a little bit more and talk with some people at the state to see because this is not my understanding of what's supposed to happen. So let me dig into this a little bit more and let me get back with you on that, okay? Let's see. So my adult son is on the A&D waiver now. No nursing services have been provided for years. No nurses want the hours we need. There's no motivation to move to stay on the health and wellness waiver. It's scary not knowing if we will eventually get to the CIH waiver. Feels risky to change. Mm, I understand. And yeah, I can't blame you for feeling that it's risky. So, you know, so yeah. Let's see. Ooh, what if there are duplicate applications? And I'm going to guess that these are Medicaid applications. So there are Medicaid regional managers, and they are, if you were to Google Indiana Medicaid regional manager, you would get a map with email addresses for the Medicaid regional managers. These are regional managers who have a lot more knowledge than the person who's working the front desk at the Medicaid office. Not disrespecting them in any way, shape, or form, but recognizing that we are the purple sparkly unicorns of the world because our loved ones get Medicaid and break most of their regular rules in the process. Those regional managers know those sorts of things. They are also required to respond to those emails within 3 to 5 business days. And so sometimes when we've got those duplicate applications, sometimes the person at the Medicaid office is able to correct all of that. Sometimes they're not. So one of the things I would do is contact one of the Medicaid regional managers or the one for your area to see if they can help you with that because it's not unheard of. And yes, it causes an administrative nightmare when that happens. In my experience, the Medicaid regional managers have been really helpful, especially with things along those lines. Um, okay, let's see. Sorry, guys, I'm going through. We are now up to like 65 questions, so I'm going through to see if if we have questions that are involving any of the things that we've talked about so far. Um, hmm. Somebody was saying about the family who's being asked for the birth certificate. I've got a parent who's chiming in that likely it's not the provider who's asking for it, and that they may be treating this as a transfer since it's a new agency that will be providing residential services. I don't know if that's really the case, but those are some things that I would definitely look into, and that's something that I'm going to look into on your behalf as well, um, so that we can figure some of those things out. Um, let's see. I will also say because we've got some like questions about like duplicate Medicaid applications and things like that. I'm going to say something that's not very nice. Medicaid has been a train wreck for the last year. As we have been coming out of Medicaid unwinding, there have been a lot of difficulties with paperwork with Medicaid, a lot of things getting lost, a lot of things just not getting processed as quickly as it normally would. So there have been a lot of paperwork issues when it comes to Medicaid. What I will say is don't give up on all of that. And that's where, definitely in that case, talk to that regional manager because they may be able to either get into the Medicaid computer system themselves or have somebody else get into the Medicaid computer system to try to fix this particular problem. Okay. Um, and um And especially when we have situations where one is Medicaid and one is the marketplace, which is something else that's coming up um, with the um, questions here. Yeah, there have been cross a lot of cross things that have been going on in the last year. So unfortunately, I'm not surprised to hear that there are some issues. Um, but and I would also say I'd love to talk to you about this a little bit more so that we can kind of dig in a little bit deeper, specifically on your specific situation. Um, okay, all right. So now let's go to the pathways for aging waiver. This is the one that's going to have the biggest changes. And this is the one that we are going to be monitoring very, very closely. So the Pathways for Aging waiver is specifically for individuals age 60 and older who are currently on the aged and disabled waiver. It is going to move from the Division of Aging to the Office of Medicaid Policy and Planning, which is one of the most powerful agencies that no one has ever heard of. The Office of Medicaid Policy and Planning is the agency that actually makes all of the rules for Medicaid. When you think of the Medicaid office, that's the Division of Family Resources. They are dealing with eligibility, and making sure that they're getting in all the paperwork to approve benefits. It's the Office of Medicaid Policy and Planning, or OMPP, who actually makes all of the rules for Medicaid. Now, you will still apply for this through the local area agencies on aging. The biggest change on this is that for the very first time here in Indiana, we've got a waiver that is going to go managed care. And it will go managed care for the health coverage and the waiver services. Now, the three managed care entities are going to be Anthem, Humana, and United Healthcare. Okay. Up until now, when we were talking the family support waiver, the CIH waiver, the TBI waiver, or the health and wellness waiver, those were all going to be are all going to be administered by the Bureau of Disability Services starting July 1st. And if you go to the Medicaid strategies page, that's where you will find all of that information. Pathways for Aging has its own website, its own set of rules. It is a completely separate entity. Okay. So to learn more, to see more of the state's information on the Pathways for Aging waiver, you want to Google Pathways for Aging Indiana and get specifically to their website because they are also having webinars where you can learn more on that as well. So one of the big changes here, or another one of the big changes, is you're going to have to learn a whole new language here because we've got a lot of term changes. So first of all, there will be enrollment brokers who will help people pick an appropriate managed care entity. MCE stands for Managed Care Entity. Again, that's going to be either Anthem, Humana, or United Healthcare. Then you are going to have a care coordinator. That care coordinator is going to help support your healthcare needs, especially regarding prior authorization needs. Basically, you are going to have to, your care coordinator will approve what health care you get. So if you need to see the cardiologist, if you need to have tests run, things like that, your physician and your care is going to have to work with your care coordinator to get your managed care entity to cover those tests or those procedures or whatever the case may be. Then you're going to have a service coordinator. That's what we have traditionally thought of when we thought about a care manager or a case manager. They're there to support your waiver service needs. You will likely also have a Medicare and Medicaid coordinator, um, because Medicare and Medicaid don't always like to work and play well together. This is someone whose job is to make the two programs work together. Then there will be member support services vendors. This is somebody who works for the state, not the managed care entity. And they help individuals or caregivers resolve issues when they're involved with pathways. So let's say you know you want certain services and the managed care entity is denying those services. Well, first you do have to go through their grievance process first. And once you go through their grievance process, then that member support services vendor would be able to take up an appeal from there. One of the other term changes, we have been used to the term notice of action when you have wanted a service. They, your case manager or your care manager would submit that request to the state. They would send you back a notice of action approving that service. For pathways, it is no longer going to be called a notice of action. It's going to be called a service authorization. And that's not something you have to submit separately. When you develop your care plan, or what is now going to be called a participant-centered service plan, which is integrating both your care plan, which is your medical stuff, and your service plan, which is your waiver stuff. They're merging those together for that participant-centered service plan. If you have a service that is listed in your participant-centered service plan, that acts as your service authorization. So they are trying to streamline it that way just a little bit. So with the managed care entities, you already had to choose your managed care entity. If you did not choose your managed care entity, you were auto-enrolled in a managed care entity. However, you also have the option to change if you want to. Once a year, coinciding when Medicare has their open enrollment period, you will have an open enrollment period for your Pathways managed care entity as well. So you can select or change your managed care entity during that open enrollment period without any problems. You will also be able to change your managed care entity once per year without any reason for it. But if you go more than once a year, if you need to change it twice in a year, for example, you have to actually have a reason to switch. And the idea behind that is they want to keep things consistent. They want to make sure that your healthcare and your services and all of that is staying consistent. So constantly changing your managed care entity adds some chaos and makes that consistency harder to do. But sometimes you do have a legitimate reason for why you need to change your managed care entity. Let's say you move from Evansville to Muncie and your managed care entity just doesn't have as many providers in your area. That'd be a legitimate reason to change your managed care entity. Let's say you develop a new condition and the specialist you need is on a different managed care, is part of a different managed care entity. That would be a legitimate reason to switch managed care entities. So there are reasons to do that. And remember, you can change once a year with no reason, just because they ticked you off that day, you can do that. But they do want to try to help keep things consistent because it winds up providing better care there. If you have problems with your managed care entity, you have to use their internal grievance process first. And grievance process is just a kind of a fancy way of saying appeal. So if you want a certain service and your managed care entity says no, or you need or want certain tests and your managed care company says no, the grievance process is the way you say, no, 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 no. It is really important that I have these tests, or it is really important that I get these services. And that is basically an appeals process. You have to go through the managed care entity's grievance process first. And once you have exhausted that, that's when you can contact the member support services vendor through the state for an outside determination. Again, I know that is not information anybody wants to hear. I'm not saying I agree with that. I'm simply saying that is the process that they have laid out to the best of my understanding. I will also say with the Pathways for Aging webinar or waiver, we still have a lot of unknowns. They are still adding to and updating medical provider lists. However, one thing that they have done relatively recently is, all three of those managed care entities have other types of Indiana Medicaid. And believe it or not, for any regular person, I know when I started this job, I thought Medicaid was just Medicaid. I was wrong. Here in Indiana, we have more than 38 different types of Medicaid, okay? Which is part of the reason why you can never seem to get a straight answer out of the Medicaid office. Because every one of those types of Medicaid have their own rules, their own exceptions, and their own twists and turns. Well, within all of those different types of Medicaid, we do have some that are what are called fee for service. So Medicaid disability is fee for service Medicaid, where every time you go to the doctor, that doctor bills Medicaid, that doctor gets paid. But then we also have several types of Medicaid that are managed care, where a doctor's office is provided a certain amount of money to provide all of your medical care for the year. And that's not true. The managed care entity is given a certain amount of money to provide all of your healthcare costs for the year. If they use it all, no problem. If they don't, they get to keep part of that as profit. We do have several types of Medicaid that are managed care. And as a result, for example, let's say a doctor provides is covered through Anthem HIP. Well, now those managed care entities have taken all of the providers they have from their other types of Medicaid and have now all approved them for the pathways as pathways medical providers as well. So if you've got a doctor who takes Anthem HIP, they're also going to take Anthem Pathways. Okay, so they're doing that to make sure that they got enough medical providers to be able to serve people. And the state has required all of the managed care entities to accept any providers who apply to join their managed care entity until the managed care entity has what they call an adequate network. Okay. I will say, even as I have said all that, man, that was confusing even to me. Basically, they're trying to make sure that they are building up a robust medical provider list as well as waiver service provider list. But we're still trying to figure out which managed care company or which managed care entity is working with which provider agencies, which medical providers. So there's still a lot of unknowns with that and still a lot of confusion from the provider side and from the medical provider side on all of this. So this is something that we're going to keep monitoring and keep a close eye on. And so one of the things I'm going to ask of all of you is please go ahead and share your experiences and share your stories with us so that we can monitor all of this and make sure that these programs are actually working the way they're supposed to. So some other pathways changes. There is also a waiting list for pathways. And right now you still apply through your local area agency on aging for the pathways waiver. Again, we don't know how long this waiting list is going to last. I will say the state has actually added an additional 5,000 waiver slots between the health and wellness and the pathways for aging waiver. So they are actually planning to serve more people. We just don't know when they're going to start pulling people off of the waiting list or how long that's going to take. The information for attendant care, structured family caregiving, and home and community assistance is the same as it is for the traumatic brain injury waiver and the health and wellness waiver. Caregiver coaching is also available through the Pathways waiver. And so now I'm going to come back up and check on those additional questions that may have come in since then. Um, let's see. Um, let's see. Okay. Um, I think some of the other things that people have added are all people that I'm going to wind up following up with, and so I can talk about some of those a little bit more directly with them because they're a little bit more personal in nature rather than universal. I also want to come back up to the top just because I know that we had some questions up there that we hadn't gotten to yet. Um, okay. I think we have gotten through most of those. And if you have submitted a question that I did not answer, um, it could be because I plan on following up with you anyway, and it could be that we have 72 questions and I might have accidentally missed it. So if there is something that you really want answered and I haven't gotten to it yet, please go ahead and resubmit it. But now I want to talk about, you know, what have we been doing? What has the ARC been doing about all of this? Well, we've actually been doing a lot. So first of all, we are talking with FSSA and the Division of Disability and Rehabilitative Services. That's the umbrella agency that oversees the Bureau of Disability Services. We have been talking with them every single week, and that will continue. Okay. We worked with the Lieutenant Governor to convene a special session of the 1102 Task Force to try to get answers back in January about that new plan that was submitted back in January. We clarified and advocated for legal guardians of adults to continue as paid caregivers through attendant care. When the plan was submitted in in January, there was some confusion because we had some state officials who were saying, oh, yes, legal guardians can still get paid for attendant care. And we had other state officials who were saying, no, legal guardians can't get paid to provide attendant care. There was that confusion, but what I care about at the end of the day is what's actually in writing. And what was actually in writing in January was that legal guardians of adults would not get paid to provide attendant care. We were able to get that changed. We haven't gotten legally responsible individuals paid again yet, but yet is the key word on that because we are not giving up. We got skilled nursing respite to be added as a separate billable service when using structured family caregiving. Structured family caregiving requires the agency to provide respite for up to 15 days for the caregiver, but that's unskilled respite. And we have some individuals who need nursing respite. That's not covered under structured family caregiving. And so we were able to get the state to agree to allow skilled nursing respite to be a separate billable service when using structured family caregiving. We also clarified that nursing and home health services question and make sure that was not affected by those waiver changes because there was a lot of confusion about that, especially back in January. And we were able to clarify that in certain circumstances, yes, family members can be paid under PA home health. Again, you've got to meet all the requirements for it, but it is possible in some circumstances. What else have we been doing? Well, we met regularly with legislators when this was all coming down to educate them about what in the world was going on. All of a sudden, they started getting tons of phone calls and they had no idea what any of this was about. We were the ones talking to them to explain, okay, here's what's going on. Here's what this means in real life. Here is how this is affecting your constituents, and really start educating those legislators. And as a result, we got some legislation passed. Not everything we wanted, but we got some. So for example, we got legislation on transparency requiring a report on the projected shortfall by November 1st. I know that may not sound like a big deal, but we have to understand where this budget shortfall occurred and what led to it, so that we know how to make adjustments for this in the next legislative session. Because in the next legislative session, it's going to be a budget session. And we need to make sure that Medicaid is not cut as a result of all this, but also to figure out, where did things go so wrong that we were $1 billion short? Those are questions we need answers to. We also got legislation requiring FSSA to set a policy by December 31st that will set a required minimum percentage of the reimbursement for personal care services that must be paid to the individual providing the direct service. That's a mouthful. Now let me translate that into human. A lot of times when I talk with families, they'll see how much that provider agency is paid, and they know they get, oftentimes maybe half of that. And they're wondering why the difference. Well, and I'll be honest, provider agencies do actually have a lot of overhead costs that come along with this. So there's some legitimate things there too. But by December 31st, FSSA is now required to develop a policy requiring that a minimum percentage of those rates be paid directly to the worker. We also got FSSA to meet bi-weekly with families about all of these changes, and especially as they've continued to make changes to what they ultimately submitted in May and what was ultimately approved. We got FSSA to conduct webinars explaining these changes and helping people prepare for all of this, as well as produce fact sheets for individuals so that they could get accurate information. But we're not done, and we're not giving up. So we are working with our federal partners. And when I say that, I mean the Centers for Medicare and Medicaid Services. We're talking with other states, and we're working with the ARC of the United States on options to make sure that legally responsible individuals can be paid as caregivers. I was talking about that minimum percentage of rates. At the federal level, there are discussions going on right now on that as well. And what they're talking about is that a minimum percentage that actually has to be paid to the worker. The discussions right now are discussing the idea of at least 80% of the rate going directly to the worker. Now, those are still just at the discussion level. Okay, so that is not imminent by any stretch of the imagination, but those are the discussions going on right now, and those are discussions that we are involved with our federal partners. We are still talking with legislators. We're also talking with candidates, because this is an election year, and so we are going to have new officials that are coming into office. So we are not just talking with the people who are in office right now, we're talking to all of the candidates as well to educate them about this issue so that it's on their radar, so that we can try to get some changes moving forward. We are still working on trying to get legally responsible individuals paid. We have not given up on that. I don't want you giving up on that either. So now let's talk next steps. First of all, right now, talk with your case managers, especially if you're choosing to switch to structured family caregiving. Let's get through this transition. But you need to talk with your legislators, and you need to talk with the candidates who are running for office, and explain to them what this means in real life. This is not their lived experience. They don't understand any of this. They don't get any of this. Ironically enough, sometimes they think, oh, well, there are programs for that. Not recognizing, yeah, this is the program for that. They don't always connect those dots. So you want to make sure that you are talking with your legislators and your candidates to get this on their radar and to influence them so that they understand the real stakes here. And I'm also going to ask you to share your story. We are part of a national Medicaid storytelling project, and the things that we are experiencing here in Indiana are happening in other states too. So I'm going to ask you to share your story, talk about the importance of Medicaid, talk about how these changes actually affect your life and your loved one's life. We need to humanize this. We need to make this real, because if it's just numbers on paper, then it's just numbers on paper. But when officials see an individual, when they can think of an individual, when they understand how it affects real everyday life, and especially when they can put themselves in your shoes, that makes a huge difference. So you can go to our website, which is arcind.org, and look for, just search for Medicaid storytelling so that you can share your story. You can either share a written story, or you can record a short video, no more than 2 to 3 minutes, just kind of summarizing what this really means for people. And of course, if you are anything like me, you will think of something, a question a little later on, maybe tomorrow, maybe as soon as tomorrow, and maybe in a few weeks, or after July 1st, if something is happening, if something is going sideways, give us a call here at the ARC. Talk with any one of our family advocates. Every single one of us is either a parent, a self-advocate, or a sibling. So we all live this life too. We understand what you're talking about, and we can try to help. We can try to help with anything that you're dealing with. And so at this point, I'm going to stop sharing my screen. I'm going to check the questions again really, really quickly, to see if anything else has come in. Let's see. Okay, I've got somebody saying, on a slightly related note, were you aware that a lot of companies have sliding scale pay? For example, if the person is approved for no more than 40 hours, they may pay $18 an hour. If they're approved for 60 hours, they drop that pay rate to 14 hours. Overtime would be $21 an hour. If approved for 80, then they would drop to $12 an hour, because with overtime being 18. Not a question for the webinar, just wanted to mention. So I probably should have read all of that first. That is incredibly interesting. I had not come across that as I'm sitting here taking notes again. So, all right. So those are all of the questions that we received today. I know this has gone long, and I know. And first of all, I want to thank all of you who have stood with us so far. And I hope that this was actually helpful. I know that there is still anxiety involving these transitions, and there's a lot that, we're going to see how it actually works in real life. But when you have questions, if something is going wrong, you are always welcome to call us here at the Arc of Indiana, 317-977-2375. Thank you all so much for joining me tonight, and have a wonderful evening. Bye-bye.